You may know the Special Olympics host summer and winter games, just like the regular Olympics, but the organization also hosts events around the world every single day. And they screen all their athletes for mental health, an often overlooked issue for people with intellectual and developmental disabilities, also known as IDD. For more on this, I spoke with Dr. Dimitri Christakis, the Chief Health Officer for Special Olympics and Editor-in-Chief of JAMA Pediatrics.
What does the data show about mental health for people with IDD, and are they getting the treatment and support that they need?
Yeah, thank you so much for asking that. You know, what we consistently find is that this is a population that is marginalized in society, marginalized in healthcare. That we often refer to them as an invisible population because they're so often ignored. About 55% of adults with intellectual or developmental disabilities have been diagnosed with anxiety or depression in their lifetimes, compared to about 10% of neurotypical adults. And on a typical day, 49% of people with IDD report feeling anxious, compared to about 8% of neurotypical people.
Is there potentially bias within the medical community about recognizing the signs and symptoms in people with IDD?
There is. I think there clearly can be challenges for people with IDD getting the healthcare they need. They have a harder time seeing physicians or healthcare providers or mental health providers. So in the past year, people with IDD who wanted to get counseling, 20% of them reported that they could not get it because it cost too much, compared to 3% of Americans without IDD. But even when they get in to see a doctor, we repeatedly hear from our athletes and from people with IDD generally that they feel like they're not treated with respect. They don't feel like they're listened to. Speaking as a doctor, that's a problem for many patients, and that's on physicians to do a better job. Most physicians aren't even getting the training they need to deal with people with IDD. Many people are under the delusion that people with IDD are happy or don't suffer from mental health illnesses or don't suffer from other problems that people without IDD have. And the sad reality is that that amount of neglect on the part of the health system has translated into shortened life expectancies for people with IDD. On average, they live 16 to 20 years less than people without IDD. And that's premature death from preventable causes of disease.
This is such a big problem. Are there any other concrete steps that we could take now to help solve it?
One of the greatest benefits that Special Olympics offers is the opportunity to participate. So people think of us as a sports organization, and of course we do sports, but we're much more than that. We have health screenings, we have health programming, and we offer people a chance to participate in a community that's inclusive. And the result of that is that studies have found that people with IDD who participate in Special Olympics have a 50% reduction in their risk of depression. And that's not so much because they play basketball or bocce or ping pong. It's because they feel welcomed and they're in an environment that appreciates them and talks with them and recognizes their humanity.
Sports are good for the body and the mind.
Absolutely.
All right, Dr. Dimitri Christakis, the Chief Health Officer with the Special Olympics. Thank you.
Thank you so much.
After the break, silencing timid